You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new treatment option for people that are suffering with chronic back pain. If that's you, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the latest advancements in the treatment of back pain. With us we have Dr. Kari Knowles. Dr. Knowles is the founder of Coast Spine and Rehabilitation Center here in Carlsbad, California. Dr. Knowles, welcome to the program.
Pleasure to be here, Randy.
Before we get into today's topic, tell us a little bit about your practice.
Well, Randy, I've been practicing for over 20 years as a chiropractor. I have a practice in Carlsbad, California, who I practice with my husband.
Your husband's also a doctor, is that right?
He is also a chiropractor.
Now, why isn't he here today?
He's a little shy on camera.
Okay, and you're prettier than he is, you said.
Yes.
So that's another reason.
A little
okay.
bit, yes.
Now, you do spine rehab, you have rehabilitation involved, so it's not just chiropractic.
It's not just chiropractic, correct. We treat a whole avenue of patients as far as rehabilitation, massage. We do spinal decompression.
Okay.
And chiropractic.
And children as well.
Children, we have patients, for example, my children, I have 2 children, they've been adjusted since they were 7 hours old.
Okay.
And all the way up to, we have a wonderful, wonderful dear patient of ours who's 93 years old.
All right, all right.
Been treating with us for almost 20 years.
Okay, spinal decompression. We invited you on the show to talk about that. In fact, we've discussed that on this show before. I was attracted to you on the topic because you are a patient. Because a lot of people, we get letters, and I'm one of those people that's very skeptical on the topic. You said 8 years you were on disability. Why don't you tell us a little bit about your background as a pain patient and why you got involved in spinal decompression?
Well, my husband and I were involved in a pretty severe auto accident in 1998. I had a very busy practice at that time. We both practiced together, but I had my own individual family practice. And after the accident, I sought chiropractic care, physical therapy, and was not seeing an improvement. Went through the avenue of most people, went and had an MRI.
Now, you were an athlete before, says here.
I've been an athlete all my life. Very active, very
You were on the
active
boys team in high school, it says.
Boys soccer team in high school, yes. First girl to ever make the boys
So
team.
you were a real athlete. Okay, good,
Yes,
good.
yes, and had been. So after the accident, I saw all kinds of doctors and finally had an MRI. I was having symptoms of neck pain, pain down my arms, numbness and tingling, and all still trying to practice.
Okay.
A very busy practice. And it came to the point where I couldn't do it anymore. I couldn't do my passion, what I loved, what I'd been doing for so long, and I had to go out on disability.
Okay.
The only upside to it is that I was home with my 2 small children. But it was
Your husband
difficult.
said that your life was pretty compromised back then.
Extremely, extremely compromised. When you become a chronic pain patient, you really forget how wonderful it is not to have any pain.
Has it made you a better doctor, by the way? The fact that you went through it?
I've always been pretty compassionate, but I feel I'm more compassionate to people. I have a lot of patience for people who are in pain, a lot of tolerance, because I completely understand what they're going through. So it is quite a bit different.
So spinal decompression comes along. Your husband's a doctor as well, treated you, you weren't getting results. And according to you on the telephone, it was somewhat of a miracle for you.
To go almost 9 years and wake up every morning with a chronic headache, drag yourself out of bed, trying to do the normal things that you need to do with your children, your husband, your household, to start some treatment, again, that we were a little skeptical about, because I had done
were you
everything.
a lot of skeptical, by the way?
Well, we have friends that are chiropractors, and we had started hearing about it.
About spinal decompression?
About spinal decompression.
Okay.
And in the 20-some-odd years that we've been practicing, we've seen a lot of modalities and therapies and treatments come and go. And I had been through the regime of all of it.
You even went to a neurologist?
A neurologist, acupuncturist, I was under the care of a pain specialist, my neurosurgeon, you know, you name it, epidurals, you know, nerve blocks.
Okay.
Nothing really helped. my husband started doing the research on spinal decompression and felt that this is something that we really needed to look into for our patients as well as for me.
So it works, and we should start there. I mean, it works.
It does.
You
work.
see results with this?
I emotionally, mentally, physically, it works. I mean, I am a true candidate. I saw results within the first 2 treatments of being on the machine.
You knew?
And I knew this.
How is this different than traction, by the way?
Traction it's a basic pulley system. Basically, you lay, whether it's neck or lower back, it's not a real targeted type of modality. It just basically stretches out the spine. And the problem with traction is there's only one direction of pull. And what happens a lot of times is patients that are in chronic pain already have severe muscle spasms and trigger points going on in their spine and in their muscles. The traction can actually set off those neuroreceptors to cause it to further spasm. And so a lot of times, traction is just not indicated for chronic pain patients.
So you were on disability for 8.5 years, and at what point did you say, okay?
Well, after 2 treatments, I saw a big difference.
All right.
And I felt, at this point in time, I found what was going to get me back into being a chiropractor and having my life back.
So you went back to work?
So I finished my treatment program. I did 20 visits, and I went back to work. I went back to work as of last September.
Ever since, have you been preaching this spinal decompression to your friends, your colleagues,
everyone,
patients? Really?
Everyone. I was just telling my husband the other day, I said, I need to call my neurosurgeon and tell him.
Oh, right, okay.
I need to call my pain specialist and tell him and let them know that there are options for their patients that have chronic pain, that basically they told me there was nothing they could do for me unless I wanted to have a surgery. And I really didn't want to have the surgery.
Now, physicians will watch this program.
Yes.
And more physicians are sending chiropractors patients for this spinal decompression. What do you want them to know about spinal decompression?
Well, number one, that the research does show that patients get better with this. Patients improve drastically. We see a long-term improvement. They don't have the severe rehabilitation time that surgery acquires, and that they have an alternative for their patients.
Are you ever surprised with the results that you get with patients?
Yes and no.
Okay.
And I say that only because I am a patient.
Right.
So it's I know what's coming to a certain degree. And now every patient's different. So,
okay.
And
you say you change people's lives. You see lives change. How so? Give me some examples.
Well, perfect example. We have a patient that she slept in a Barcalounger, a recliner. 10 years. She could not lay in bed with her husband. So to not be able to have that portion of your life, to enjoy that with your husband.
So people have to sit propped up.
I
don't know a whole lot of back pain patients.
Yeah,
so it's a big problem. A lot of people going through this.
Up. And after the decompression therapies, I mean, to have that back, to have that nurturing part of your life back with your husband and your family, and it's phenomenal. It's
how big of a problem is back pain? And we're talking about neck pain and back pain, or just low back pain?
Is huge. Neck pain, back pain. Lower back pain is greater than neck pain. Okay. Statistics show that 6.5 million people suffer from back pain on a daily basis.
Okay.
And that 5.4 million people don't go to work because of back pain. And one of the other statistics that you and I were discussing was that over 500,000 lower back pain surgeries are done every year in this country, in the United States. And that's the second leading reason for surgery.
So of those 500,000 people then that have surgeries for back pain, are you implying that some of those could be avoided with spinal decompression?
Oh yeah, maybe half.
Half, okay.
I mean, I understand as a chronic pain patient that those people and myself went through every possible scenario. And
before surgery. Before surgery,
but you get to the point where there's nothing left, and those people and myself have to try the most conservative avenues, and spinal decompression is conservative. It's non-surgical.
So what do you say to the patient that is watching this and they're skeptical, and they're on blocks or whatever, and this sounds, in a way, too good to be true, gimmicky, or whatever. What do you say?
I invite them in. I invite them in for a free consultation. Have them come in, speak with us, bring all of their records with them, bring their x-rays, their MRIs, and we will let them know if spinal decompression is right for them.
Okay, let's begin there. What type of back problems is this good for? And then I want to know a little bit about the mechanism. What's going on? How does it treat it?
Well, spinal decompression is good for chronic pain, lower back, neck, due from herniated disc, spinal stenosis, osteoarthritis, and bulging discs. And those are the ideal candidates that have suffered chronically from years or trauma or...
So if somebody goes to you, how soon before you know, okay, you'd be a great candidate, in your opinion?
We do go through a process in our office. We do a thorough consultation with the patient.
You do it?
I do it.
Okay.
I do the consultation, or my husband does the consultation. We both do it. And we will sit and talk with them, find out what their history is, find out what has happened, assess what is going on in their life. We want to know what's going on with them. And then after we determine, okay, this is not contraindicated for you, we've seen an MRI, we'll do a thorough evaluation of the patient. So they'll have a thorough exam done, orthopedic testing, neurological testing, all the basics, blood pressure, because we want to make sure that they can be okay on the machine. And then we will go ahead and get started with some treatment. And then some people, Randy, after one treatment, see results. We had a patient in the other evening, and he had suffered from back pain for years. He's a maintenance man, and he's having difficulty doing his job. He's got numbness and tingling in his hands and arms. He was on the table for literally the first few minutes, and he started to fall asleep. And this is a gentleman that hasn't slept well in years, and within the first treatment, he saw results. It was phenomenal.
You talk about this. How do you measure pain? Because we talked on the phone, you say that just about every patient gets results. So how do you determine results?
Well, a lot of times we base it on a pain scale of 1 to 10. 10 is debilitating. And I've actually felt a 10. But a lot of times the patients will come in and they will start at, let's say, 8. 8 is pretty severe pain. And after a few treatments, this gentleman I was just mentioning, he was down to a 5. That's life-changing for some patients. I mean, an 8 to a 5, that makes a huge difference in a daily activity or a daily routine of what somebody can and can't do.
Now, you ski now, you're active, you used to be a triathlete.
Yes.
And do you give the credit to, and we're going to take a quick break, but do you give spinal decompression credit for the fact that you were able to go back and do these things?
I do.
You do, you really do.
I was literally too afraid and in too much pain to do any of the things that I love to do, and I would have liked to try and do them, but I couldn't.
Okay. Why are so many people skeptical? Because anticipating this interview, I speak to doctors, and I also spoke to some pain patients, and they don't believe it for the most part. Why is that?
Well, I think people, a lot of times in our society, have to see it to believe it.
Okay.
And it's coming, and they're going to see it, and they will believe it. I mean, the more people that do go through the treatment program of spinal decompression and see results, because we're getting phenomenal results.
Do you think it's because insurance doesn't cover it yet, and eventually it will?
That's probably a little bit of a detriment, but honestly, it's affordable. It is truly affordable.
You have programs less than $100?
$100 a month.
Okay.
And to qualify for that. And you know what? We've had patients tell us, the chronic pain that I've been in, it's worth $100 a month. I mean, I would have paid a lot more for it than $100 a month.
Yeah, and people are getting better.
And people are getting better.
Every week. Okay, we're going to take a quick break. We come back, I want you to help me understand how you're able to fix or help the herniated disc, bulging discs, things like that, because I don't quite understand that. So you brought some models. We'll get to those. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's about back pain. We'll be right back. How bad was your neck?
My neck was literally basically killing me because I'm the type of work I do. My neck is, I'm propped back all the time. I'm working on mobile homes. Okay. So when I'm scrubbing and whatnot, it just puts a lot of pressure on the spine and the neck.
What were you doing for it before you did spinal decompression?
Basically nothing. Going to the gym, taking a sauna, trying to relax. So I really didn't do anything. I was just living with it.
Okay, so you went in. Tell me what happened after the first treatment, or during the treatment. What was it like?
The treatment, actually, when you first go in, you're wondering, about it. But they were very, courteous. There was no problem at all. I got on the table. They adjust a couple bars, come up around your neck.
Did it hurt?
Nothing. It didn't hurt at all.
You feel good?
So, well, actually, yeah, it did. Once they adjusted, put the bars up, and then hooked me to the machine, it was just a matter of just lying there and relaxing, and basically I was falling asleep.
Okay. How long did you live with the problem with the neck? I mean, how long were you dealing with it?
I probably have had this problem with the back and the neck, mainly the neck, for about the last 3 years.
How soon did you start feeling better? And describe the pain. I mean, how much better did you feel?
Well, again, within the first treatment, within the next day, I was feeling totally. I mean, on a scale of 1 to 10, I'd gone to about a 5. And
so you were a 10, went down to a 5.
Right, right. And I was able to go back to work the next day. My problem is that I'm continuously thrashing my body, so to speak. Working. And so really, to make this work, it's kind of common sense. You've got to let the treatments do their thing. And I've gone through 9 treatments now.
So are you sold on it? You love it?
Oh yeah, I'm totally sold. I would recommend it to anybody.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, advances in the treatment of back pain. With us we have Dr. Knowles. Okay. And we've talked a lot at the break. And now, so you believe that there are a lot of people that are suffering?
Absolutely.
From back pain that don't have to be?
Absolutely, Randy.
Okay.
They don't have to suffer. Those people have had chronic pain. They've done everything that they could possibly do. And they are skeptical. But they need to make that call. They need to find out if there's a doctor of chiropractic in their area that's doing spinal decompression, a medical doctor, and go try it. I mean, we've had patients that have made that call just prior to 2 weeks being scheduled for surgery. And they've come in, and the results have been phenomenal. They canceled the surgery.
Is that right?
They didn't have to have the surgery.
You say you're oftentimes the doctor of last resort. What do you mean by that?
Well, they've tried everything else. They've tried the injections. They've tried. Usually, it's a conservative, and it builds. The physical therapy, the injections, chiropractic, just adjustments, the nerve blocks.
Did you try all those things?
I tried everything. Everything that my pain specialist could send me to, I tried. And that's why when we started doing the research and we found people who were improving and getting better, and it was life-changing, long-lasting results, I had to try it. Okay.
I told you I try not to endorse the doctors on the show. And I have a doctor that's a medical doctor, the biggest pain center in the Palm Springs area. He's getting one of these machines because he said, Randy, I couldn't look the other way any longer.
Yeah.
People are getting results.
Exactly.
Because I thought it was, just not true or an exaggeration or gimmicky.
Right.
And the patients are getting results.
Absolutely. Absolutely.
So are doctors coming around, medical doctors, as they hear about it, know about it?
I think they are. I think they're becoming a little less skeptical. They're seeing some of the results. They have patients coming into them and saying, I'm not going to have the surgery. Why? I went and had spinal decompression. Really? Randy, for doctors that are watching this, that watch your Wellness Hour program, we ask them, we invite them to give us a call. We can sit down and talk to them about it. We can explain to them.
What if their fear is they send you a patient and that you're going to badmouth their medication protocols?
Every profession is a needed profession as far as the medical profession.
Okay.
There are patients that do need surgery. And we're not going to take that patient through the protocol of spinal decompression if they're not a candidate for it. We will send them back.
Have you sent people away and you say,
Absolutely.
no, it's not good for you?
Absolutely. And here, let me show you an example.
All right.
This is the most common patient that we will see. And what this is a vertebra. And these are the bones in your spine. These are the nerves that come out of the bones in your spine. And this is your spinal cord.
Is that a bulging disc? What is that?
Basically, this is what happens when your disc herniates into the spinal canal. Okay? And this is part of the nucleus that is herniated. And you can see the difference in how big this nerve is versus this nerve.
So this bulge is
affecting that nerve supply.
nerve. And that
is
causes
what's causing the pain.
Okay.
Absolutely, absolutely. And that is an ideal candidate who has.
But what I don't get is how the decompression on this machine is taking away that pressure.
What it does is it creates a negative pressure that pulls and separates the vertebra. And what happens is the actual disc material is sucked back in to a neutral position.
The fluid.
The fluid.
I mean, are you puffing up the disc?
Nucleus, the disc itself, is pulled back in to a neutral position. And then what happens is once it is brought back in over several treatments, then the disc itself will grab and absorb nutrients from other tissues around it.
Is there any science behind this? I mean, you have proof of this?
Oh, definitely. Oh, definitely.
Okay.
This goes back to the original founder of the DVAX machine, which was in 1991, is Dr. Dyer. He's a medical doctor from Canada, and he suffered from back pain. And he was a medical doctor. He had done everything he could do. He started researching and researching. He knew typical traction only made his symptoms worse, and he developed this avenue of creating this negative pressure that actually.
Is it painful though? What about the older patient? Because these are fragile people.
We have all ages. We have all ages of patients. We have elder patients.
Is it painful for certain patients? I mean, they're in back pain to begin with.
For most part, no. It's a very gentle process.
Okay.
And most patients actually see less pain when they're on the machine.
How long does it last? I mean, when the treatment is completed, isn't it just going to go back to the way it was?
Well, there is a little follow-up to it, but it is a permanent treatment, because what happens is when you get to the point of when you finish your treatment, this is what you see as a normal disc, okay? And so it will actually pull that disc material back in.
So the body
the nutrients
heals itself.
And the tissues will heal itself. Exactly, and that's what happens.
Can they show that on an MRI?
Absolutely.
A before and after?
We have
Really?
We have studies of before and after of our patients. I have studies of my neck before and after.
What are your results, by the way?
My results were 100%.
Okay, but I mean, in your practice, somebody goes in and you say, okay, they're candidates. How many of them get better? Half the time?
85 to 90% of our patients see dramatic results.
I know we have to say results not typical. And, and I think people need to realize that this is a real interview. I mean, you're not scripted.
No,
you're not reading a teleprompter.
Absolutely.
You have been invited on the show. And you've also, been through the treatment. But you're saying people get better.
Oh, they do. Absolutely. Okay. And as I mentioned, 85 to 90% of the patients that go through their protocol and their treatment that we give them see that results.
And what happens to this bulge then?
It goes
resorbs, or
it is. What happens is the bulge itself and the fibers that hold the disc together, it draws the bulge back into the center of the disc. I mentioned it goes away. Typically, what happens is the bulge will retract. It is drawn back in to the center of the disc, and the areas of the outer part of the disc that have lost their strength and their fibers, they slowly heal from the nutrients being absorbed back into the nutrients, the fluids, the oxygen being absorbed back in from the decompression, the actual negative pressure. And that's where we see the huge results.
What could the critics say about this, by the way? Somebody tuning in.
Well, they can always argue that it doesn't work.
All right.
Okay? We're seeing the results. Another thing that a critic could say is there's no research. And there is research. And just as we mentioned, before and after MRIs, I mean, you can clearly see that you go from this to this.
Okay, okay.
And
so is this one of those things that earlier treatment is better?
Absolutely.
And if so, why?
We would love to see a patient, say someone fell off a ladder and they had severe back pain. Their doctor referred them for an MRI. They clearly showed on the MRI that there was a bulging disc.
Okay.
Now, this is an ideal person. Well, let's not put them through all this conservative therapy that may not give them positive results.
Okay.
So, yes.
I mean, are you biased, obviously, that they should do this first?
Yes.
Really? Okay.
Well, I think it's a lot of time and a lot of money and a lot of energy, insurance, money out of patients' pockets. If we know, which we do,
right,
from the results of our patients that it works, why not do this conservative method first?
Now, we are out of time completely. Final message, somebody out there in pain that doesn't believe it.
Please give us a call, or a local chiropractor in your area, a medical doctor that has a machine.
So what do they say? What do they ask for?
Call and ask for a consultation.
Spinal decompression therapy.
Non-surgical spinal decompression therapy. Give us a call. We'll be happy to have you come in for a free consultation. We'll sit down with you. We will find out if you're a candidate for this life-changing type of treatment.
Are there patients that are on medications that have weaned off or
absolutely
got rid of them completely?
Absolutely. I mean, you have chronic pain patients, myself as well, that were taking meds every day. That's not great for the inside of your body as well. And when they get to the point where they start to feel better, they can slowly wean off or completely stop taking
Do you know people, besides you,
absolutely,
that was able to completely get off meds?
Almost every one of our patients that has gone through spinal decompression were on some form of meds, whether over the counter or prescribed.
If it's as good as you say it is, why isn't everybody doing it?
They don't know about it.
They
need to know about it.
All right.
They need to call and find out about it.
Okay, great. I want to thank you for coming on the show. Very interesting.
Thank you so much, Randy. It was a pleasure.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.